Hello and welcome to webinar series. And myself, Shanti Bhattacharya, the Vice President Nursing, Yashoda Hospitals. And today the topic I have chosen is of thyroid health because you all know as we are witnessing a lot of growing concern about the thyroid cancers and overactive issues with the thyroid glands, not only overactive, underactive as well. For this, I now welcome our expertise, none other Dr. K. Sreekanth Garu, who is our senior consultant and a surgical oncologist from Yashoda Hospitals, Somajigoda unit. I welcome you, sir. Okay, maybe sir will join again. And I now request all the speakers to introduce one by one. Yes, Lydia, over to you.
Myself, Lediya Swapna. I'm a nursing officer from Government General Hospital and I'm from Mahbub Nagar.
Yes, we welcome you, Lydia. Yes, we
Thank you,
do
sir.
have,
Thank
Tripura Queen who is Lipika. Yes, Lipika, over to you.
Hello everyone, a very good afternoon. Myself Lipika and I am from Tripura and currently I'm working as an associate professor at Tripura Institute of Paramedical Sciences and I'm very happy and pleasure to be here as a part of this discussion. Hoping for a
Thank you.
great
We
session
welcome
ahead.
you. We welcome you as well. Yes. Hema, do you,
Yes.
yeah, yes.
Yeah,
Do you wish
thank
to
you,
tell?
ma'am.
Yes.
Yeah, ma'am. Good afternoon, everyone. I'm very happy today because of my busy schedule. I can't able to communicate
Yes.
properly.
No
Sorry for that,
problem.
ma'am.
No problem. We understand
Okay.
your
Yes, ma'am.
situations. Yeah,
Yes, ma'am. Thank you,
the
ma'am.
session is going to be time bound. So yes. Shrikant sir, are you there, sir? Can you just check with the Dr. Shrikant? Yes.
Yes, ma'am, he's joining. Yes.
Yes. So we will be trying to understand as we all know, anytime we start any academics, we should also understand the epidemiology or the current status of these issues like thyroid cancer, So we will have shortly, sir, who can just give us a little information about it. Yes. So, yes, Hema, do you witness any thyroid patients who comes to your clinic, like maybe patient, maybe a case
Yes,
of
ma'am. Yes, ma'am.
hypothyroidism? Yes.
Yes,
Yes.
ma'am. The cases
So
will be
what
there,
kind of
ma'am. Yearly,
prescription your
my
doctors?
population is. Yeah, ma'am. Based on the thyroid levels, we will give them already. We will suggest to first consult the endocrinologist, ma'am. They will
Yes.
decide the doses, ma'am. After that, from government, the different three types of doses tablets will come, ma'am, from Kurnool district
Yes.
main branch DMH office. So
And what?
that tablets we will distribute to patients, ma'am.
Okay, so the more of what do you see, like hypothyroidism or hyperthyroidism?
Hypo, ma'am, hypo. I'm
Hypothyroidism.
working place Kosigi. Here, most patients are hypothyroidism only, ma'am.
Yes. And uh, among which age group do you see? It is among, sometimes do you get to witness the among male as well?
Yes, ma'am, male and female, ma'am. Female
And what,
patients are more, ma'am,
okay,
compared
what
to
is the
male
age
patients.
group?
Age group nearly 20 from 27. It will start, ma'am.
Okay,
My
okay,
patient only from 27, nearly 62, till 62 age, ma'am. They will consult, ma'am.
okay. So do you also witness among the antenatal mother as well? And
Yes, ma'am. Yes, ma'am.
you
When
do?
we are having antenatal checkups, some antenatal mothers are having using the hypothyroidism medicines, ma'am.
Yes, yes. So we again like to see Dr. Shrikant. Yes, sir, Mirunara, sir.
Yeah, I'm there. I'm there.
Yes,
I'm
yes.
live.
So, sir, as
Am
we
I audible?
started, yes, as we
Yes,
started
sir.
now,
Yes,
we'll
sir.
be just,
Audible, sir.
yes, we'll be just talking intermittently, like as we would like to understand from your insight, from your end, what is the current status of thyroid cancer as a health concern among women, sir? Over to you.
See, basically, when it comes to thyroid cancers in women, I
Yes,
think unfortunately they are more prone when compared to men.
yes,
So there are almost about 3 to 5 times higher risk of cancer in women than men. It is usually seen, the thing is, everybody will think cancer means it will come after 50 years, 60 years. Now, thyroid cancers are they generally occur at an earlier age.
at earlier, yes.
Anywhere between 15 years to 50 years. more commonly. We see
Yes.
thyroid cancers in older people also, women also, but it is seen in younger women. So what happens is, many times when we see a thyroid nodule here, mass, they think in this age, who will get cancer, so they will not bother.
They'll ignore.
Okay?
Yes.
So, but 7 out of 10 times, whatever nodule they see in the thyroid is not cancer in women.
Yes. Yes.
Okay? And only 3 out of 10 times it is cancer.
Yes.
But still, when they see a nodule in the thyroid, when they feel or when they see, they should consult a specialist. As they said, either endocrinologist or a physician or an oncologist or whatever it is.
Yes.
And other thing is, in men, it is less when compared to men. But in men, 8 out of 10 times when it comes in men, it is cancer. It is exactly reverse, almost reverse. In women, what I told, 10 people when they have thyroid nodules, only 3 of them will have.
3 of them. Yes.
Whereas in men, when they have 10 men have nodules, 8 of them will have cancer.
So prevalence among men is higher.
Less. Prevalence among men is less. But the
Less. Sorry. Yes.
prevalence is more in women. But the chance of cancer are less in women.
Yes. Yes.
But the prevalence of nodules are less in men, but the chance of cancer in men is very high.
Contracting cancer is higher. Yes. So
I hope all of you got the point, no?
Yes. Yes.
Yes, sir.
Yes, sir. Yes, sir.
Yes. So now we will have, I think the speakers from other end, also from other facility, also would like to ask you for your valuable insight. Yes, Lipika, over to you.
Yes, ma'am. So actually, as you have mentioned about regarding the facts of prevalence of this cancer, thyroid cancer among men and this thyroid issues among women, I personally belong from the hilly states. So I do see a lot of this reproductive age group women, they're having the thyroid issues. So, well, yes, sir. So what are means the things I should, being a person, should achieve the balanced thyroid functions, or I can say the optimal thyroid health one should do for maintaining the wellness of this thyroid issues.
Okay. See, I think Lipika, you and Hema also, I think, mentioned that they see most of the times they see hypothyroidism in their places.
Yes.
Yes, sir.
Yeah. So when you are, especially when you are from a hilly state, usually they are prone for hypothyroidism.
Yes.
So because what the literature says is, the salt which is there, which is there in the hilly states, is usually deficient. They have the salt doesn't have iodine. Generally, the water, everything is iodine deficient. So what we do, the government advised is the salt should be iodized. Iodized. So from the time of 9 years of age for any girl or woman, it is advisable that they take this iodized salt from that age.
Yes.
In fact, everybody should take iodized salt there, because the iodine content in water and food is less in hilly areas.
Yes.
So it is mandatory that everybody takes iodized salt, so that the iodine that is required for the thyroid functioning is adequately available for either boys or girls. In the women or girls during the puberty age and all, the demand for the thyroid hormones is very high.
Very high. Yes.
What happens when the demand of thyroid hormones is high? The thyroid is how the thyroid hormone come? It is from the iodine only.
Yes.
Thyroid gland will produce thyroid hormone by taking iodine from iodine. When the iodine is not there, what happens is the gland overfunctions. It starts functioning more to produce more thyroid hormone. The gland enlarges. So when the thyroid hormone iodine is available in enough quantities, then the thyroid hormone will function more also without enlarging.
Yes.
So it is important that the iodine content of the food or this thing should be higher in hilly states.
Yes. So yes, we will also like to understand the iodine rich food and iodized salt about it. Going forward, like this, even I wanted to ask from your insight or from your answer, what are the main functions of the thyroid? As you were mentioning, the iodine intakes or it should be more during the pubertal age, and is it influences almost every organ in the body?
Yes, exactly. Thyroid hormone is very essential for the for the functioning of many organs.
Yes.
Especially, it is important in regulating the body temperature. Okay,
Yes.
in
Yes.
maintaining the body metabolism.
Metabolism.
And also, yes, and metabolism includes everything: the heart rate, the functioning of muscles, bones, everything required. We only think that calcium is important for bones. Yes, calcium is very important,
Very
but
important.
iodine is also very important. Is important for bones and muscles. So it is
Yes.
important of regulating the body's metabolism. So when body metabolism is less, it affects all the organs.
Yes.
Thyroid hormone may not be directly needed for heart, but when the
Yes.
metabolism is altered, the heart also gets disturbed, the liver gets disturbed, the kidney gets disturbed, the ovarian function, the reproductive function gets disturbed.
Yes.
So it is important in maintaining the body's metabolism. So when the body metabolism gets disturbed, every organ gets
Entire.
disturbed.
Yes.
Yes. They are all related to metabolism.
Yes.
So that's
It
how
is
it
all
gets.
co-connected. Yes. Yes, going forward, we do have Lydia the other side. Yes, Lydia, please do ask your insight. Yeah.
Sir, good afternoon, sir.
Good afternoon,
Sir,
Lydia.
myself, sir, I have a question that do we have any issue if there is any enlargement, that is goiter, or in the case of nodule, sir? Do we have any issue with breathing difficulty or thyroid enlargement because of the thyroid enlargement? Does it put a pressure on the trachea or esophagus, sir?
Yes.
And sir, also we like to also understand from your end, what are the early signs which we should be always monitoring and careful about? Yes.
Okay. See, the thyroid gland is closely related to the trachea and the esophagus, the breathing pipe and the food pipe.
Yes.
So when the thyroid enlarges, obviously it will compress or it will push
Yes.
the thyroid and the esophagus and trachea, which are beneath it.
Yes.
But only thing is, small nodules will not disturb it. When the size of the thyroid gland is more than 5 centimeters, then it will start pushing. When it is even more, after 5 centimeters, every centimeter increase will cause an effect on the trachea. And the esophagus will not be affected first. Usually the trachea is affected first.
Okay.
And the second thing is, as it increases, their voice nerves which are regulating the voice also are there, recurrent laryngeal nerves.
Yes, yes.
They also get affected when the size increases. But when it is not cancer, generally there will not be alteration of voice. When it is cancer, they involve the nerves also, that time the voice get altered. That is the thing regarding the pressure on the esophagus, and the size is important. When the size is bigger, it affects. Then regarding some symptoms, what are the symptoms which we should look for during thyroid? It all depends on whether the patient has a hypofunctioning of thyroid, hyperfunctioning of thyroid, or whether there's any cancer. When there is a hypofunctioning of thyroid, that is hypothyroidism, then there will be weight gain, there will be facial puffiness, they will be low, the BP will be low, the pulse rate will be slow, they'll have more sensitivity to cold temperature. What is normal for other people, they'll feel very cold. They'll have constipation. They'll be very more drowsy. Drowsy in the sense they're very dull. They'll
Dull,
not
lethargic type, yes.
Because the metabolism becomes low.
So,
when the metabolism becomes low, they are all very dull. They're like as if they're every time they'll be feeling sleepy.
Yes.
And there'll be some weight gain. So these are all the things which are there when the thyroid functioning is less. So when the thyroid functioning is more, it's reverse. The heart rate will be more. They'll have diarrhea. They'll be very, very irritable and restless. And their body temperature will be high. They cannot tolerate heat. Little bit of heat also they'll be sweating. Okay. And they'll have, when the hypothyroid, they'll have weakness, as I told you. Here they'll have excessive stimulation. And they'll have some higher, when the toxicosis is more, the hyperthyroidism is more, they'll have the eye issues also. They'll have mood swings. They'll get disturbed for very small thing. So all these things are there when the thyroid functioning is more or less. When it comes to thyroid cancer, usually these things are not seen.
Yes.
In thyroid cancer, the thyroid values are usually normal. They'll not have this hypo or hypothyroidism sort of a symptoms in 95%. 5% of the times they may have. 95% of the times, thyroid cancer doesn't have any symptoms or signs of hyperfunctioning or hypofunctioning. In thyroid cancer, what you have to see is any alteration of voice is there, any breathing difficulty while walking, any dysphagia, difficulty in swallowing.
Yeah.
Swallowing. These are any enlarged veins here on the chest wall, in the neck and lower chest, lower neck and the upper chest.
Yes.
These are all the things which are there, which you have to see when there is when you suspect a cancer.
Yes. Yes. Very
So
valuable insight you have provided. Yes, Lediya, Lipika, yes.
Yes, ma'am. I have a little query, sir.
Yes.
Actually, you have mentioned regarding the warning signs, like there is in mood changes or irritability, or the person also may have this constipation, diarrhea, according to the thyroid issues. Sometimes those symptoms, it also can mimic like other diseases, like the menopause or depression or anxiety. How we can quickly identify those symptoms means as it is mimicking like other condition at the same time.
Good question, Lipka. Thing is, see, mood swings are there for everybody. We go home, somebody, wife irritates, children irritates, we'll get mood swings. So that is normal. Okay, normal means that happens regularly. But then you should also see, and menopause also you'll have mood swings. Then that's why you have to correlate everything. You have to see what age. Okay, when a woman with mood swings comes at the age of 23, 24, 30, it's not menopause, no? So you have to see whether she's in the menopausal age around 50 years. Okay. And then not only the mood swing, when the mood swing is there, you should check whether the pulse rate is normal or abnormal. So you have to correlate all other things.
Yes.
Pulse rate should be high. The temperature intolerance should be, for heat should be more. Okay. And you have to check for the tremors also, the hand tremors. So you have to correlate all the things and then see, it's not only the mood swing. Mood swings, so everybody will get in everyday practice. Shanti will have so many headaches, you will have so many headaches, sisters will have so many things. So mood swings will happen. So you have to correlate all other factors also.
Yes. Other contributing factors. Yes. Yes. So, sir, yes, as Lipika asked very great questions, and at what age should women or young female, whether they, yes, it is very difficult to detect only if they come to you, like you're the expert who can always prescribe the safest modalities. So, at what age one should go for what kind of check, like thyroid profile, or if at all they have this behavior, they might go to general physician, and after that, they might refer to you. Like at what age one should, take care of uh, oneself, like by checking few kind of parameters.
Generally, we don't have any screening protocols for thyroid hormone level.
Yes.
In some families, what happens, mother will have a thyroid enlargement, hypothyroidism, and grandmother also will have, like that family, if they have thyroid enlargement issues, then they should start getting it checked from the age of 12 years onwards, because puberty, that's the time when the hormone. So they have to keep checking thyroid level hormone, that's all. They have to see how the alterations are every year. Once in a year, they have to check T3, T4, TSH.
Yes.
And they have to keep that values like that only, because what is there in 13 years of age, 19 years of age, they may be changed. So they have to compare the values and see whether there's any alteration.
Yes.
If there is no family history of goiter or anything, then what they have to do is, when they find some symptoms like lethargy, weakness, fatigue, easy fatigability, getting tired very easily, and gaining some weight without eating much, that time they should think that there should be some thyroid, they should get the thyroid profile.
Some triggers, yes.
So you should, suppose somebody is gaining weight without eating much, there should be some reason, some hormonal issue. Thyroid is one of the issues. There are many other factors for that. So you have to check like that. And if there's a family history of thyroid cancer, especially two relatives in one family get thyroid cancer, then they should start checking the thyroid ultrasound, especially from the age of 35 years onwards.
Okay. Yes. And what are the risk factors for a male getting thyroid issues or cancer, sir? What could be the risk, as you keep seeing a lot of patients to your OPD? Yes.
The risk factors for thyroid cancer in either men or women are usually very less. Usually it is, we say, genetic causes. As I told you, in the family, if two people will have, then there is a possibility of other family members having a risk of cancer. So they should be careful. Second thing is hormonal issues. That is usually in women. Men, the hormonal issue is not a factor in men. In women, it's a hormonal issue because
Yes.
estrogen hormone and thyroid hormone have shared certain common factors. So when in a woman who have a high estrogen levels, they also have a higher chance of getting a
Yes.
goiter.
Yes.
So hormonal factors is one thing, and family history is other thing. And the second thing is any exposure to radiation in younger ages. Suppose some people who are working as a radiographer technician in the X-ray machine without covering this, they have a higher risk of cancer. So some
Yes.
patients for who have a fungal infection in the scalp, we give radiation. Nowadays we are avoiding. Those days they used to give radiation. That radiation also is a risk factor for thyroid cancer. And those people who have been exposed to the radiation exposure explosions, like Hiroshima, Nagasaki, where there was a
Yes.
nuclear bomb
Yes,
explosion,
sir.
and then
In
Bhopal
Japan,
gas
yes.
tragedy, where there was a nuclear thing. So people who are about 5-10 kilometers around this explosion, they would have got exposed to the radioactive material. So they also have a higher incidence of thyroid cancer. So these are the three common reasons or risk factors which are there for development of thyroid cancer.
Yes, I think, yes, Lydia, I think, yeah, possible causes has been spoken about, like genetic, hereditary, and, predisposition factor. Do you also have any other concerns to be asked from?
Yes,
Yes,
ma'am.
yes, ma'am.
Excuse me.
Yes,
Yes,
Hema,
ma'am.
you wish to ask?
Yeah, yes,
Yes.
ma'am.
Yeah. Yes, over
Sir,
to
good
you,
afternoon,
Hema.
sir.
Go ahead.
Yes, good afternoon.
Yeah,
Please.
thank you. Sir, is there any effect of heart, sir? Hypothyroidism patient, thyroid, sir?
Yes. Yes, as I told you, when thyroid hormone is responsible for metabolism.
Yes, sir.
Hypothyroidism is there, the whole metabolism will be slow. So the
Yes.
heart also will get enlarged.
Okay.
Cardiomegaly.
Heart also will get
Oh,
enlarged. So in
okay, sir.
hypothyroidism, the heart is enlarged. You have water around the heart, pericardial effusion.
Yes.
Long-standing hypothyroidism, long-standing uncontrolled hypothyroidism.
Okay. So,
Okay, sir.
Hema, yes. Yeah.
Ma'am, I have a
So,
question.
yeah, Lipika, the
Lediya.
insight you would like to,
Lediya.
or Lydia, yes, over to you. Anybody?
Good afternoon, sir.
Good
Sir,
afternoon.
I have a question. If uh, in pregnancy cases, if a mother is in the third semester, in the third trimester, and if she is diagnosed as a thyroid cancer, then what does the management does it other than conservative management, what we can do, sir?
Okay. Only conservative management till delivery. Because
Okay,
thyroid cancers are generally not very aggressive. Suppose if they are in the third trimester, your children are going for exams, huh? Lydia?
yes, sir.
That's because you're talking about semester instead of trimester. I thought they're
Sorry,
not
sorry,
And
exams.
sorry.
she's
Yes,
a faculty
I'm
as
working
well.
as a teaching
Yes.
faculty, sir.
Because semester bole to I thought now semester
Yes,
exams
sir.
are going on.
Yeah,
No?
I know.
So,
Yes, sir.
Trimester is
okay.
replaced with semester.
So that
Yeah.
in third trimester, when they are detected to have thyroid cancer, we will wait till the pregnancy gets over. After the pregnancy is done,
Yes.
then we'll take the thyroid because they generally don't spread so fast.
Okay,
Yes.
sir. Does it affect the child also, sir? The fetus?
Thyroid cancer will not get transmitted like that
Affected.
from mother to the child.
Mother
Only
Okay,
to
sir.
child.
thyroid hormone levels has to be checked because when
Yes.
during pregnancy the thyroid hormone requirement will be more. It will be required for the mother also. It will be required for the child
For the
also.
child
Child.
also, yes.
So
Newborn.
those values have to be checked. It will not
Okay.
get transferred from mother to child like the thyroid cancer.
Okay,
So we have to
sir.
wait. In the second trimester, we operate.
Okay, sir.
In the first trimester, if you detect thyroid cancer, then we'll wait for the first trimester to get over. And then we'll do it in the second trimester because in the first trimester, when the mother is exposed to anesthesia and all, the child gets affected. So we'll wait for 4 months.
Okay, sir.
And in the 5th month or 6th month, we operate safely. We can safely operate without any problem or damage to the child.
After they get operated, do they have any vocal changes, sir? Voice changes?
If I operate, nobody will get vocal changes. If other people operate, I don't know. If I operate, there will not be any vocal changes.
Okay, sir.
Yes.
But
I
after
mean,
operation,
there will not be any problem with the voice gaining, resuming the voice.
Voice changes.
That's all. If the surgeon is good, there will not be any voice change. If the
Yes.
surgeon is bad, then there may be he may damage the nerve because the nerve is very
Yes.
fine. So they have to
Okay.
be very careful while operating.
While operating, yes.
And
yes.
second thing is, during the pregnancy, if they operate and remove the thyroid gland, thyroid should be replaced.
Yes.
They should give the thyroid hormone.
Okay.
Otherwise, there'll be chances of miscarriage and development of mental retardation in the child. So thyroid hormone is a very important
To
hormone
be
during
replaced,
pregnancy.
yes. Yes, Lipika, do we have, we do have Lipika, the other end? Yes, Lipika?
Yes, so as you have spoke about the risk factors or the contributing factors and the thyroid glands activities affecting the other parts of our organ. So what are the treatment options we do have if somebody is having the thyroid issues in case of cancer, and what are the prognosis at the same time, and the complications which may affect the treatment plan?
See, usually the only treatment for all thyroid issues except for hyperthyroidism is surgery only.
Surgery.
Surgery.
Okay.
Whether it may be thyroid cancer, it may be hypothyroidism with nodules, even hyperthyroidism also sometimes. Okay. Most of the times it is by surgery only. Very rarely we put them on medication. For hypothyroidism, sometimes we control it with tablets. Hyperthyroidism has to be controlled with medication and then either operated or treated with radioiodine therapy.
Therapy, yes.
Okay.
And for thyroid cancer, it's only surgery. The only treatment is surgery. Generally, thyroid cancers behave well. They have a high cure rate, except for anaplastic thyroid cancer. That is a very deadly cancer. But fortunately, the occurrence of that cancer is very less. 80% of the times it is well differentiated thyroid cancer, 80 or 85% of the times. 10% of the times it is medullary thyroid cancer. Only 1 or 2% it is anaplastic cancers. But when anaplastic cancer comes, the cure rate is almost 0% or 1%. 99% they die with the cancer, unless they are detected very early.
Very early, yeah. And sir, like, do they also come with a recurrence? So sometimes you.
Yeah, they do come. The recurrences, like any other cancer, recurrences can happen in this cancer also.
Yeah,
but the chances of recurrence are less, as I told you, when the surgery is properly done. They have a very high cure rates.
So is there any complications which may affect the treatment plan if somebody is undergoing the thyroid surgery or any thyroid issues if they are getting treatment?
As I told you, the thyroid surgery carries 3 or 4 complications. One is the voice change, alteration of the voice. Second thing is, when both the nerves are damaged, then they'll have breathing issues, severe breathing issues, wherein we have to do a tracheostomy. And third thing is hypocalcemia, when they remove the whole thyroid, calcium deficiency. Because parathyroid glands, which are very small, if they don't preserve the blood supply for the parathyroid glands, then they become hypocalcemic. So these are the 3 main important complications. Other things are wound infection, hematoma. Those things are all which is there with every surgery. These are the 3 complications which are generally specific to thyroid diseases or thyroid surgeries.
Yes. And that is the reason post-operatively we need to monitor calcium and infuse the prescribed amount of infusion. Yes. So we have come to the end of the discussion.
As a nursing, this thing, one important thing is when a surgery is done for a thyroid patient, the next day, you should not wait for the cramps and all those things. An intelligent nursing supervisor or nursing in charge or nurse, they should elicit for early calcium deficiency. They can do it by checking this. They have to tap the nerve here. If they tap the nerve here, then you'll have twitching here in the mouth and in the eye. Okay. Or if you tie a BP cuff to the hand and inflate it to 120, beyond 120, then they'll develop severe cramps in the hand. So these are the 2 things by which you can check whether there is any early calcium deficiency or not.
And this sign is called something, one name is there for this sign, no sir?
Yeah. This is Chvostek sign.
Chvostek sign, yes.
And this is one sign which I can't.
Chvostek sign, I was remembering that,
Chvostek sign. So you should elicit those things.
Yes.
First thing is when you go, tap here, both sides, okay, and check. And tie a BP cuff and check. Yeah, when you do this, there will be twitching here.
Yes.
This one and this one.
Okay.
Yes.
And when you tie a BP cuff, normally what happens when you go to 180 also, when you will not get the cramps, you will only feel some pain here, tightness. But at 120 or beyond 120, you'll have severe cramps in the hand.
Yes.
That means, oh, there is a deficiency. So you should elicit that and tell to the concerned doctor. So the doctor will be very happy that my nurse is very good.
Yes.
Okay.
Yes.
Right.
And we have come to the end of the discussion. And yes, sir.
So soon we came to end so soon.
Yes, because
Okay.
we were time bound.
No problem.
I have the order that we should not consume, surgeon's time.
I have locked my door already. People are tapping there outside.
And sir, yes, what could be a few helpful tips, or in terms of diet, in terms of iodized salt, in terms of managing stress or exercise, you would like to tell to us, sir, so that we get better day by day learning. Yes.
So,
over to you, sir.
especially, I think, I don't know, either Hema or Swapna told that they're in Mantralayam and they keep, for the rural
Yes.
population, they do, and
Yes.
Lipika also. See, you should encourage, especially girls. Boys get somehow iodine. The girls will have the iodine deficiency. So you should encourage them to take iodine-rich foods.
Yes.
Okay, which is like spinach, leafy foods, and then almonds, certain things you can go through, and then you have to tell them. But unfortunately, many of them cannot afford those things. See,
Yes.
people who are financially good are okay. In the rural population, in the hilly area belt, they are usually, see, the financial this thing may not be that much. But there are certain natural things where you can advise them to take in more quantity. If not, then
Yes.
iodized salt. Because the problem is they cannot take 1 spoon of salt, no, they cannot tolerate. So you should encourage those things. And second thing is, when you go, apart from looking into their eyes, you should look at the neck also.
Correct.
Okay, you should look at the neck. You can easily make out little bit of alteration in the size or swelling. Okay?
Yes.
That's where many patients may not realize, but your eyes should focus there also.
Look at the neck. Yes.
Encourage taking iodine-rich foods. Just explain them that these are the things. Anytime somebody sees while swallowing, if there's any movement,
Yes.
the thyroid gland, they should. Second thing is family history. When they have a family history of hypothyroidism, they should get the blood thyroid profile done yearly once. Family history of cancer, they should get the screening for thyroid from the age of 35 years onwards. And then healthy diet and regular exercise. Be aware. They should be aware of what are the symptoms and signs of hypothyroidism, hyperthyroidism.
Hypothyroidism. Yes.
Few things.
Yes.
Correct.
And
So,
the moment
yes.
they find, they should report to Lipika or Lediya or Hema.
Hema. Yes.
You should report to Shanti, and she should report to me.
Yeah, we can always come for your
No problem.
intervention, sir. Thank you so much for enlightening with very simple, precise content. And yes, do we have any more insight to be asked to, and we can just end the session? Anybody? Yes. So yes, that was very great, wonderful session, sir. And I would urge and request to all the viewers to refer www.yashodahospitals.com for more of the academic and health updates, because I keep seeing Dr. Sreekanth the other day. He was giving a lot of information on thyroid cancers and many more other updates. And yes, stay tuned for the next interesting topic. And I thank Dr. Sreekanth for your valuable time, sir. And I thank Lipika, Lediya, and Hema for your valuable time as well. And I'm here to end the session. Thank you.
Thank you, Shanti. Thank you so much.
Thank you so much.
Thank you, sir.
It
Thank
was
you,
nice
ma'am.
interacting with all of you.
Thank
you.
Yes,
Thank you.
Thank you.
Okay. Thanks, Lipika.
Thank you,
Lediya.
sir. Thank you.
Thank you, sir.
Take care.
Thank you, sir.
Thank you.